inviting Vantari to this month's SIMCAFE webinar. So we're super excited to be here today and incredibly grateful for the opportunity to introduce Vantari, virtual reality training for healthcare. Just to elaborate on the introductions, as Udi said, my name is Tina. I'm an intensive care nurse and the business development manager at Vantari. And joining me on the call is Jay, all the way from Seattle. Jay Cologne is our head of product at Vantari, who has over 15 years experience in the healthcare simulation industry. And finally, we have Dr. Shirin Narula on the call, who's our clinical partnerships lead at Vantari with a background in critical care and hospital administration. So in today's session, we're very excited to share some insights into the company and how we got started, how our technology works. We'll also share some of the research that we've conducted and which really highlights the value of VR, along with some examples of how virtual reality can be integrated into training and education. Then we're going to wrap things up with a live demonstration coming from Seattle, which will be super exciting. And please feel free to jot any questions that you might have in the Zoom chat, which we'll ensure to cover off today. All right, so I'm just going to get started with the presentation and introduce you to Vantari. So Vantari is an Australian-owned company founded by these amazing gentlemen in 2017. Dr. Nish Shanth Krishnanathan and Dr. Vijay Paul come from a strong medical background. Nish is a surgeon by background, specialising in urology, prostate and bladder cancer, whilst Vijay has specialised in emergency medicine. They both trained at Bond University in Queensland and have worked across numerous hospitals in Australia. It was really through their experiences that they observed a significant gap in the way clinicians are trained to perform medical procedures. Traditionally, the see one, do one, teach one approach has been the norm, and a method that, while valuable, can be quite subjective and unfortunately can lead to preventable medical errors. So this realization really inspired Nish and Vijay to co-found Vantari with Daniel Paul, who you see on the screen is our Chief Technology Officer for Vantari, and he brings over 30 years experience in VR, AR and AI to the team. So moving on, the vision was clear. It was to revolutionise medical training by offering clinicians a safer, more standardised and immersive way to practice procedures before performing them on real patients. Today, Vantari's platform is a globally leading health technology company, really bridging that gap and providing a solution that not only enhances clinical skills, but significantly reduces the risk of error and improves patient outcomes. So I'd like you all to imagine Vantari as the flight simulation for healthcare, empowering doctors, nurses and students to practice clinical procedures in a safe, scalable virtual reality environment. So you might be thinking, well, how does it all work? Let me break it down for you. You can think of Vantari like an app that you download onto your computer. You log in to the Vantari software platform using your personalized credentials. You pop on your headset and you're ready to start. From there, you'll find yourself immersed in a lifelike medical environment, whether that be a theatre, a cath lab, an ICU room, or even an ED bay. The immersive experience is so powerful that it feels like being in the real thing. You get to choose a medical procedure that you'd like to perform, and you'll be presented with a virtual patient. That could be a male, a female, an adult, or a pediatric, and all of the necessary equipment that you need to perform the procedure from start to finish. The platform can also simulate more challenging scenarios and complications, something that's impossible with textbooks and even limited with mannequins. And throughout the whole procedure, a virtual trainer will guide you every step of the way, and a procedural board will track your performance, providing real-time metrics and data analytics. So all of this can then be seamlessly uploaded into your own personal digital logbook, an ideal solution for meeting competency requirements maybe hospital accreditation, whilst also obtaining CPD points. So moving on to show you a snapshot of some of our modules. At Vantari, we do support a multidisciplinary approach, making it highly adaptable for various domains, such as cardiology and critical care. This includes intensive care, for example, emergency and anaesthetics. So what this means is that it can be effectively implemented across multiple departments within a healthcare sector. Our platform offers a comprehensive suite of medical procedures, ranging from basic tasks like an IVC or an ABG gas, all the way through to more complex procedures, including chest drains, central lines, emergency cryoc, tracheostomy care, even intracardiac echo. And in a moment, Jay will demonstrate all of this for you. He'll also showcase some of the advanced features like physics-based interaction capabilities. These include, for example, the use of ultrasound and image intensifiers, such as fluoroscopy, MRI, and CT, all in real time, along with the patient's vital signs monitoring the patient, and even a haptic framework that allows for complete immersion whilst practicing these procedures. So you might be thinking, well, how do we build them? We actually build all procedures according to college guidelines, or sometimes we'll tailor the procedure according to an organization's specific protocol. This really standardizes the way of learning and eliminates any subjective bias. So I really hope this gives you a greater understanding of how the technology of Vantari works. I'm now going to pass you over to my colleague Sheeran, who will share some of the evidence and the use case scenarios for Vantari virtual reality. Thanks, Sheeran. Over to yourself.
Thanks, Tina. So what you see on the screen here results from a phase 1 blinded randomized control trial that the University of Wollongong conducted in 2021 using our Vantari platform. And so what this study involved was 44 final medical year students who were randomized to 2 cohorts to learn how to perform an arterial blood gas. One arm of the study was learning through the traditional way on mannequin, and the second arm was given just 1 dose of Vantari virtual reality training. And so after this 1 dose of a training session in Vantari, the students were then assessed by senior clinicians on a couple of factors. So they were assessed on their knowledge, how they performed the arterial blood gas, any errors that were noticed during the performance of the procedure, and then specific factors related to safety and hygiene. And so what you can see here on the slide is a few key callouts. The results showed that in the Vantari VR cohort, as compared to the mannequin cohort, there was a 40% reduction in error. And so examples of errors for this procedure were, for example, the angle of insertion and the advancement of the needle till flashback occurred. There was also a 32% improvement in performance being successful completion of the procedure. And in terms of the specific factors related to safety and hygiene, excuse me, there was a 39% improvement. And those safety and hygiene factors included, for example, cleaning of the insertion site, as well as safe handling and disposal of sharps. And so this is just one of the studies that have been published, which validates the Vantari VR platform for both its feasibility and success as a training modality for medical procedures and healthcare simulation. We're continuing to perform further studies in partnership with other world-renowned medical institutions, such as Harvard Medical School, Henry Ford Health, and Royal Prince Alfred Hospital here in Australia. And we're validating more complex procedures as well that we have in our platform, such as central venous access, chest drain, and surgical cryoc, and also with more doses of VR. But as a general trend, what we're seeing is the building of evidence for virtual reality, such as Vantari VR, that supports its use case as a platform within healthcare, and specifically its advantages as compared to other modalities in improved performance, reduction in medical error, and improvement in safety and hygiene. Here on this slide, you'll see a few logos that refer to our partnerships. And Vantari, as Tina mentioned earlier, is a healthcare first simulation technology company. Well, what I really mean by healthcare first is we're clinician led, so that includes our founders who are doctors and clinicians such as myself, Tina, and Jay within our team. And we also strongly collaborate with key stakeholders within healthcare organizations, and that includes, for example, hospitals, simulation centers, universities, and medical device companies. And our partnerships, these stretch across the globe from Australia to the US, UK, and Europe. And from these logos, you can see flagship partners, for example, in Australia, Royal Prince Alfred Hospital, Liverpool, Fiona Stanley Hospital. In the US, Harvard Medical School, Johns Hopkins, Henry Ford, and Mount Sinai. And then medical device manufacturers and providers such as B. Braun, Boston Scientific, Intellios, and Janssen. Within these environments and with our partners, they're used within different settings. So they're used within the hospital and simulation centers and universities to train clinicians and university students. With our medical device companies, we create digital replicas of new and existing products that they have, which is then used to train their staff internally, as well as allow these medical device manufacturers to showcase their products externally to clinicians and provide the associated training for these products. On this slide here, you'll see a number of use cases and value benefits across 5 key segments that Vantari provides. And so these categories are in broad clinical governance, accreditation and credentialing, CPD or CME, accessibility and wellbeing, and enterprise-wide impact. So for example, in Australia, related to clinical governance, hospitals are governed by the National Quality and Safety Standards. And Vantari, through its structured training program, as a tool which reduces medical errors and improves safety and hygiene, helps meet some of these national standards. In reducing error and clinical harm, it's also a useful solution to meet recommendations that come about from clinical incidents and medical legal claims that occur. The second category, in terms of accreditation and credentialing, Vantari supports the Australian Medical Council and APRA standards for training of clinicians. And so the digital logbook, it provides an accessible and also an automated way for documented evidence to be provided for supervisors of clinical training, as well as for hospital administrators, so that they can use this information to support the accreditation and credentialing process. So some examples can be for example, new staff orientations, such as intern doctors or new grad nurses, for junior medical officer specialist training program accreditations, nursing credentialing for procedures, as well as just in general integration within the usual teaching curriculum. And so I'll give you an example. An example of integration into a hospital teaching curriculum where we've seen with Vantari is when new junior doctors are commencing their first emergency department or intensive care rotation, the supervisors of training have said that these new junior doctors are required to complete in VR, in the Vantari platform, 5 chest drains and 5 central lines to competency. Before then, their supervisor approves them to be able to do this procedure under supervision on a patient for the first time. So that's an example of integration into the standard teaching curriculum of a hospital. The third category, in terms of continuing professional development or continuing medical education, CME, we work with peak medical bodies and societies, and some of those in Australia include the Australian College of Emergency Medicine, College of Anaesthetists and Critical Care, and College of Nursing, and the US societies like the American Heart Association. What these partnerships effectively mean is that clinicians can maintain and also upskill within procedures and also meet their annual requirements for CPD. And so that can either be time-based CPD or procedural requirements for their CPD. The ancillary benefits of Vantari, which leads to the 4th point of accessibility and well-being, is that when you train in Vantari, you build a muscle memory of the procedure. And so this decreases the cognitive load of a clinician when they're performing a procedure on a patient for the first time. And so with decreased cognitive load comes improved confidence and reduced stress, especially for junior doctors who are doing this procedure for the first time. And so what it really does is it targets the root cause of stress in clinicians, in that the potential to cause harm to a patient. It also improves the accessibility of providing training, where some training sites, clinicians may not get the opportunity to perform some types of procedures just due to the fact of not having exposure in that hospital to that category of procedures, or due to the frequency of a rare procedure like a surgical crike. And so they may not typically get enough volume of procedure to be competent. And so what Vantari does, it standardizes the baseline training opportunity for all clinicians, regardless of geography. And then finally, all of these benefits also filter up to the hospital or health district or enterprise level, where it provides multiple benefits to the organization in terms of cost savings and a return on investment. And so some of these examples are, so for example, when practicing in virtual reality in Vantari, it then saves the mannequin for final assessments, and so reduces wear and tear of expensive mannequins. And in reducing the wear and tear, it helps extend the life and replacement costs of expensive mannequins. It also, with VR, through having unlimited use of equipment built into the VR environment, it reduces the need for opening new plastic packaging of equipment packs. And so that then creates a sustainable and positive environmental impact. With the inbuilt standardized trainer in Vantari, it saves the valuable time of senior clinicians who can then spend that time and preserve their time for supervision where it really counts. For example, when they're supervising a junior doctor on a patient. And then in terms of the largest return on investment benefits, this is through the significant cost reduction related to medical errors. So, and to give you an example of the cost of medical errors, a medical error related to a procedure can result in an increased hospital length of stay of a patient from just 1 day up to 3 to 5 days, as well as increased care requirements. So a patient may need to go to a high dependency unit or intensive care unit. And so just this increased length of stay and care costs, that can be in the range of about $10,000 per patient per year. And so when you're a hospital with 40,000 to 200,000 patient admissions in a year, these $10,000 increased costs can quickly add up. And so even just improving this error rate by a small percentage amount can add into savings to the hospital of hundreds of thousands or millions of dollars in costs. And then where these really add up is when these medical errors result in medical legal liability and costs related to those, where those costs can range annually to a hospital or a health district in the tens of millions of dollars. And so preventing just even one medical error a year can result in immense financial benefits for a hospital, as well as, of course, the positive impact in preventing errors for the patient. And then lastly, these improved processes are providing innovative medical education and developing clinicians who are both competent and continually advancing. It helps attract and retain clinical staff who are otherwise working in an environment where they may feel burnt out and are looking for hospitals which are more attractive in nature to work at. And then finally, the innovative aspects of VR also provide an avenue for hospitals and universities to conduct further research and really push the envelope on medical education simulation training. And so in summary for this slide, it's a highly valuable proposition for adopting Vantari for hospital departments and enterprise-wide. Patients benefit from improved outcomes and reduced medical error. Clinicians benefit from improved training, and the organization and health system benefits from improved outcomes at scale, reduce administrative burden, reduce medical legal liability, and financial return on investment. So here in summary is a summary of the overall presentation, which is that Vantari is founded by doctors and it's a clinician-led healthcare technology company. It's used internationally in Australia, in the US, and across the globe by a number of healthcare stakeholders, such as hospitals, universities, medical device and pharmaceutical companies. It's a training platform that provides standardized training at scale. It's supported by innovative patents and engineering behind the scenes with our software engineers and artists, with the ultimate mission of really democratizing access to a high standard of healthcare training. Finally, I'll leave this slide here. This really concludes our presentation. And so I'll leave this testimonials up on the screen here from senior clinicians who use Vantari and work with Vantari as our partners. And so these senior clinicians are from renowned institutions such as Yale, RPA, Harvard, and Henry Ford. And I'll hand over to Jay to run a live demonstration whilst you have a look through these testimonials.
Thank you, Sharon. Can everybody hear me okay? Sharon, can you hear me?
Yes.
Perfect. Before I get started and put on the headset, thank you everybody for joining us. I'll be giving a demonstration with the headset on, which will then be represented on a 2D screen. So of course, when you put on the headset, it's a lot more immersive experience. So we are giving you a representation of that by streaming. In the headset, there is no latency. It's a latency-free experience. But in your end, due to me actually streaming from Seattle, if you experience any bit of latency, it's only because of the internet connectivity and not in the platform itself. I will be using these headset pieces, which will serve as my right hand and my left hand, which then enable me as I go in and interact with any of the items. I am simply applying a grip functionality, and my thumb toggle stick is sitting on the toggle stick, which is right over here. So as you see this, you'll understand what I am doing specifically with my hands. I will disappear off video and I will be right back.
Do you want to share Jay?
Yep, just getting to it. Perfect. All right, can you see my screen, Udi? Perfect.
Yep.
So our experience is a laptop tethered to a headset. So I'm on my laptop, which is a high performance laptop, connected to a link cable, and today I'm using the Meta Quest 3. I've opened the application, and every user has user credentials that they can utilize, which then keeps tracks of their performance metrics. So residents, fellows, and so forth can practice procedures anytime, anywhere, and the data is generated to their profile, which I will demonstrate at the end, which we call Vantari Connect. And users, administrators, and educators can provide feedback, review their performance, and so forth. So I'll go ahead and hit submit, and the system will tell me go ahead and put on the headset. So I will be right back. Hi, Udi, can you hear me?
We can, Jay. Thank you.
Perfect. So I am welcomed by a welcome screen, which gives me a quick introduction to the control scheme. Everybody can see my hands. There is hand tracking built in, which then enables me to go in and start interacting with my virtual surrounding. So as I come in here, we're in a hybrid operating room, which serves as our lobby, and this is my procedural board. So think of myself being able to go to various different procedures, as well as different parts of the hospitals to be able to practice procedures. Up here, I've used my user credentials and I'm in private practice mode. So my data is going to flow under private practice profile onto the Vantari Connect system. It is very, very easy to create different classrooms, different departments. So if I wanted my data to flow to, say, Johns Hopkins, if I belong to that specific classroom or a department, I can just simply toggle and my data would flow to that specific part of my profile. So what I will do is I will stick to private practice. There is a controls tutorial, which enables a first-time user to go in and get comfortable with the control scheme and so forth. So for example, I can pick up a clipboard. It's physics enabled. Vantari really is the nexus of very best technology founded by our creative director, CTO, and principal engineers that have come together and met the clinical mind and expertise to be able to bring the two components together to build this platform. So for example, I can simply go in and interact with items with real lifelike interactions. So how does it all come together? So I can go in and select in a procedure in cardiology. So the first thing I'll showcase is a very simple fluoroscopy views tutorial. So the user can we bring the training directly to the user. So instead of going to a simulation center or a clinical skills lab, you actually are able to go into a completely immersive experience. In this case, I'm in a cath lab. I will go ahead and mute the virtual facilitator. You may not be able to hear it because I'm not sharing the system sound, but this is our virtual facilitator. It's a step-by-step guidance in terms of a voice speaking in my ear, directing me how to complete the procedure. I can skip steps, and I can deviate from this path. And I'll talk about open sandbox simulation here shortly. As I progress through the procedural board, I can actually go in and start doing a specific procedure. So in this case, we are just doing very, very basic fluoroscopy views. There are training aids available to me. You see this very subtle beam, which is where I am supposed to take this C-arm to. And you can see the emitter and the receiver as the energy penetrates through the patient that's sitting and is in its transparent form. It generates a fluoroscopy image. This is dynamic, and what I mean by dynamic is I can go in and interact with medical device consoles, such as this IGS system, and as I go in and move this knob, it actually translates the C-arm into any position that I require. So although I am supposed to be taking this the C-arm specifically to the RAO view, I can actually deviate from the optimal path, therefore learning in a safe, scalable manner. The best way to learn is to make mistakes, but we do not want to make them on patients. As I move this, it actually generates a real-time fluoroscopy image. And as I progress through this procedure, there is a second training aid, which is in terms of how are we beaming that energy through that specific heart. We can bring in any catheter, medical instrumentation in the course of doing a procedure. A quick demonstration of that is, as you see my hand, not that you would do this in the real world, it generates a real-time image of my hand interaction as the energy penetrates through my hand. So if I make a pointy finger, it'll translate in real time. So that's one of the foundational pillars of the Vantari system is dynamic medical imaging, whether that's fluoroscopy, image intensifiers, as well as ultrasound. Once I've completed that module, or I just, in this case, for demonstration purposes, I will exit. I will go directly back to the lobby. Tina and Udi, is there any latency that you're experiencing on your end due to Wi-Fi?
There's a little bit, Jade, but it's not too bad. I think if you just move slowly, we'll be fine.
Okay, thank you. The second component I can showcase is let's go in and do a totally separate procedure. So we will now go into the emergency medicine department and go do a crike, which in North America is performed very rarely by anesthesiologists. In this system, I'm in a totally immersive experience with ambient sounds and the chaos of emergency medicine department. I'll go ahead and mute the virtual facilitator. I have a patient. I have medical instrumentation that's available to me. I can interact with any of the medical supplies at any given time. And there is a scoring metric, which we will talk about, our next generation performance metrics. So the procedure tells me identify the cricothyroid membrane. So I will go in and I will show you tissue deformation, and I am getting tactile feel through a vibration framework that's built into the controllers, which can be optimized for intensity and frequency. So as I apply, I can understand anatomical landmarks and the value that's displayed in terms of the pressure and so forth. The correlating metrics are captured. I can then go to the laryngeal handshake and make a transfer stab incision. So I'll go ahead and make a transfer stab incision. You can see the next fidelity, the very high fidelity capability of our simulation, where a medical instrumentation with this intended action is causing the correlating output, which is actually going in and making cavity hair. So I'll go in and pull. And this is where it gets really, really interesting because the material properties are accounted for, and I will show this when I do the right heart catheterization. So this is a bougie. It has various different markings. I will go in and start inserting the bougie. And as I insert the bougie, the system is giving me real-time feedback in terms of the optimal guidelines or optimal way to do the procedure. So it is as if my instructor is looking over my shoulder and giving me feedback. But we can quantify the data down to a millimeter level of accuracy of how I'm interacting with the medical instrumentation in context of a procedure. So insert bougie. If everybody can see these markings, let's just advance it to about 15 centimeters, as you can see. And you see these values changing in real time. And what I mean by sandbox simulation is we give users the ability to make mistakes in a safe, scalable manner. So for example, say I go backwards, forwards, I have that freedom, but say I want to go in and I want to insert it up to say 25 centimeters. I'll go in and insert it. Right away, the system will say, this is a critical failure. I've inserted the bougie too far. So the system recognizes what's the optimal way to do a specific procedure that's built in, as well as soft fails in terms of what is acceptable method. So I can continue this procedure, but some other components I would like to showcase is the power of virtual reality is enabling new perspectives, the power of 3D visualization. So as I go in and insert, and as I go inside the airway, I can visualize what I am doing outside of the patient and the correlating interactions that are occurring inside the patient. At the end of this, I will just showcase very quickly, although I did not complete this procedure, you've got real-time performance metrics that are available in terms of where I did poor, where I did good, and where I can improve. I can select any of the components that I did not do well, and it will give you feedback in terms of the optimal way to improve that performance. And if I go to page 2, which will capture the infractions, it will say I inserted the bougie too far, hence my reason for failure. I will go back and now bring it all together with a very quick demonstration of ultrasound, and then we'll do a simple right heart catheterization overview. Are there any questions, Tina, in the chat?
No questions at the moment, Jay.
Okay.
Thank you.
Perfect. All right. So now we are in a hybrid operating room as well. I have about 40 different medical instrumentations that are available to me on my tray table. It's a 45-step procedure. I won't do all of it. I will spare you some time. I have a medical imaging system, which is my ultrasound system. I have my image intensifier. I have my patient, and I have my patient monitor. There is no substitute besides a clinical environment to be able to bring all these components together to date. Vantari has been able to accomplish this by enabling users to converge all the different components of their training to be able to bring it together, where a user such as myself, who's non-clinical, can put on a headset and practice this procedure and make mistakes. There are training aids available, identify anatomical landmarks. So let's go ahead and get started. And as I progress through, the system is checking me off. Let's clean the site of insertion. Now there is the beauty of the system in terms of sandbox simulation is you can do things in and out of order. So for example, I can drape the patient and that will get checked off, but I have not cleaned the site of insertion. So you can do things out of order, or you can just continue completing the procedure without actually cleaning this specific site of the patient. Locate the right internal jugular vein. Now, one of the things I would like to showcase is you don't need very expensive medical equipment, which prohibit and usually are a bottleneck to training, because this type of equipment is only used to see and treat real patients. So here's an ultrasound probe, and you'll see my finger as I go in and slide it across the transducer. So it's physics-based simulation that enables you to follow the principles of physics to be able to generate ultrasound images. I can rotate the transducer. I can interact with the console and turn the Doppler off, and you can visualize that in real time. So let's do a few steps here. I'll go in and apply a probe, identify the IJ. I will go in, and medical instrumentation can be annotated to help the user understand simple things such as what that catheter kit contains, as well as where that specific medical instrumentation should be used through the course of the procedure. We'll go ahead
Excuse me,
And
Jay.
yep,
We'll just get you
go
to
for it.
pause for a second. Things are just catching up with your voice. Yep.
No problem. Are you able to see the ultrasound image now, Tina?
Yep. And we can see that you're picking up your lidocaine syringe and needle.
Perfect. Awesome. So what I will do right now is go in, and as I insert this needle, it will be tracked, as you can see on the ultrasound image. And as I navigate various different parts of the anatomy, it is real-time interaction. So I can visualize dynamic medical device imaging. So I'll go in and do a local lidocaine block. So let's go ahead and do a simple pilot puncture. So if I do a very simple pilot puncture, I'll go in and get a good view. I'll go long axis. There are training aids available. So for example, the midline check to make sure that my needle stays to the right of the midline. There I've gotten access. So I'll go in, and there is flashback of blood. So I can verify that. I'll grab my guide wire and start inserting it.
I think we're a little bit behind you, Jay, just so you know.
No problem. I will slow down.
Yeah, if you pause just there for a second, we're just catching up with the pilot puncture now. I'll let you know once you've got your blood access.
No problem.
Yep. Blood access now. You're inserting your guide wire. Green needles coming out.
Perfect. So I'll just do a few more steps and then we'll exit this experience. So I'll make a stab incision very quickly. I'm now inserting my micropuncture sheath. I will take my J-tip guide wire, uncoil it, and start inserting this. And I will then go in and proceed with my 7 French sheath, which I will insert into the patient. All right, so here,
Just
very
pause there
quickly.
for a second, Jay.
Yep.
Just a little bit behind you.
No problem. I will hold tight here.
Great to see your use of your bins and your sharps bins there, Jay. And we're ready for the catheter now.
All right, thank you. So as I've gotten vascular access, I can then do catheter prep. So for example, we are accounting for air. So I can pull back the balloon syringe, connect it to the balloon, and then as I go in and inflate or deflate the balloon, that is visualized in real time. One of the things that makes Vantari very unique is material properties and being able to interact with real lifelike behavior of said in medical instrumentations. So what is floppy actually is floppy, which then tricks the brain into thinking that I'm actually holding that specific item. So I will use a saline syringe very quickly to de-air the catheter. So I will very quickly do that. At this point, my ultrasound system has moved and my image intensifier system has come in close proximity to me. I will go in and perform a quick thermofold dilution. And just a few more steps here to be able to show you the physiology engine, and I'll go in and connect the catheter to my patient monitor.
And
So as I go in...
Sorry, Jay, we'll
Sorry,
just
go
get you
ahead.
to pause again for us.
No worries. I'll pause right here.
Just catching up. So what we're seeing on the screen now for everyone is flushing that catheter.
Thank you.
And as Jay said before, the image intensifier now comes to the forefront and the ultrasound machine goes to the back. It's performing the thermodilution. And connecting to the transducer now.
Thank you, Tina. Perfect. So as I have this catheter, as I begin to insert it into the sheath, it will then provide me a real-time X-ray snapshot of the catheter moving through the cardiac structures. So there I am in the superior vena cava. So as you see, I can go forwards and backwards, and you can visualize that. And that is brought together by the patient waveforms. So if you look at the SVC, I can confirm I am in the superior vena cava, and I'm getting a central venous pressure. I'll give you a quick demonstration of that, and I won't go beyond that because we are limited on time. So say I close the stopcock, it will flatline, as you see right there. So as I progress through this procedural step, we are accounting for patient monitoring, dynamic medical imaging, the interconnectivity of all the medical instrumentations working together to enable user to go in and practice. And then it is all brought together by my virtual facilitator, which is keeping performance metric and logging the performance metrics of the user on the back end, which I will showcase. So Tina, let me know when, and I'll just very quickly showcase some ultrasound functionality and jump out of the headset.
Sure. So the catheter's going in now, Jay. So after this step, it might be best to stop sharing and then reshare because we're behind you. But what we can see on the screen now is that catheter definitely on the IR machine, the changes of the waveform, which you've told us about.
Perfect. All right.
And then turning that stopcock obviously pauses that waveform, so all in real time. Thanks, Jay.
Hi, Tina. Can you see me again?
We can. Thank you.
All right, perfect. So yes, I can continue on with this procedure and getting various different samples, but I will pause here because we are limited on time and we will take questions. I definitely want to leave some time for questions. And very lastly, I'll showcase some more ultrasound functionality very quickly and the training aids that are available to learn various different components of medical imaging and bring it together in the context of a procedure. So in this case, we are going to be in a cath lab. And this is really, really powerful simulation because you have a patient with you've just seen me achieve vascular access in the neck, but in this case, the procedures can be configurable and modified in the sense. So in this case, we've started the simulation with femoral access already having been achieved. So I can go in and grab this ice catheter. And as I go in and insert it, it will generate a real-time ultrasound image on the screen. So as you can see, I'm interacting with the device and is generating an image. So the virtual facilitator said, advance ice cath to the right atrium. I've done that. Now obtain a right atrium home view. And now this is where it gets really, really interesting, because you would typically require an instructor looking over your shoulder while you're managing this catheter on a patient monitor and an ultrasound screen to be able to then teach somebody. What we've done is we brought it all together. The virtual facilitator tells me, with the ice catheter in the right atrium, find the right atrium home view. The home view is obtained with catheter in neutral. The structures in this view are right atrium, tricuspid valve, and right ventricle. Okay, so what if I don't know what those structures are or where I can find them? There are many training aids available to the user. If with a click of a button, I can toggle on anatomy. The heart is beating, and I can visualize that. And this anatomy does change in real time as I go in and get that in my frame of view. The second training aid available to me is this patient is draped. Now, with the click of a button, I can make that patient transparent. I can visualize how this ice catheter is going through the femoral vein and into the IVC. This heart is a replica of the patient's heart, so just for ergonomic reasons, and giving you the ultrasound image side by side in the same frame. With another button, what you have is a green beam and a purple beam. So there you go. The green beam, think of it as leaving little breadcrumbs in the virtual space in terms of where the optimal image should be achieved. So we've left a little breadcrumb per instructor's guidance to be able to see where I need to specifically take this specific catheter. So I feel like, okay, that's pretty well aligned. I can then look at depth, interact with the knob, which then behaves in terms of increasing and decreasing depth on the user interface of the ultrasound machine, similarly with gain. And as soon as I submit an image, it will then go in and move the breadcrumbs, which is the training aid, to the next spot where I'm supposed to take my catheter. Now, the beauty of this is we enable users to make mistakes in our system and in our training platform. And I will emphasize that again, because although I am supposed to be doing this specific procedure, I can actually take this catheter up to the anywhere I desire and navigate it directly there. Therefore, it is a full open simulation, which instructors can then utilize by simply deviating from the optimal path as well. I will, at this point, jump out of the headset and give just 2 more minutes on the backend dashboard. Can everybody hear me? I've turned on my video. Perfect. So on the back end, we have a browser-based learning management system that's been developed, just as powerful as our simulation is. Equally special that and powerful system that you need on the back end is to, what are we doing with all the data that's generated in this 3D space? So I've logged in. I have my user profile, which says, welcome back to group. As you recall, I've practiced my procedures in private practice. And any institution that I belong to and that I'm a member of, I can simply click there and my data would flow according to. So instructors can manage users, classify users into different classrooms, different departments, and so forth. Today, I did a handful of procedures, so let's actually just focus on right heart catheterization. I can actually go into more stats, so it's a step-by-step breakdown on how well I did just a few minutes ago. Anybody using my account or belonging to my cohort, the best time was 5 minutes, 30 seconds. Average time was 10 minutes, 39 seconds. So what is this user doing really well that they really stand out from an average? You have a step-by-step breakdown of trends and time spent from the cohort on every individual step. And today I did 53% of the procedures. You can see I skipped step 2 and then step-by-step breakdown of what my outliers are and so forth. The system does keep track of any specific steps that you have failed. So I will give a quick demonstration of that. So say if I went in and did a chest drain insertion, and as I go here, what you will see is a step-by-step breakdown, as well as, okay, for this specific session, the user failed the first time, and the second time they made the optimal incision. Each user session is logged and then reported back. To sum it all together, Vantari enables users to practice anytime, anywhere without the need of an instructor, because the instructor guidelines are built in, without the need of medical equipment and medical instrumentation, and most importantly, without the patient present. Traditional simulation has specific limitations which just do not enable a comprehensive ecosystem that enable you to practice specific procedures such as the right heart catheterization. Vantari has brought this together and on the back end made a powerful dashboard so one glove does not fit all in terms of performance metrics. What I mean by that is if everybody that's in the call, was able to do a procedure in a traditional manner, which is see one, do one, teach one. First, it's the logistics of getting everybody in the same time into the same simulation workshop. The second component of that is it is going to be gross teaching in terms of one glove fits all. But what Vantari has been able to showcase is you practice at your own time, own pace. So by the time you get access to an instructor can give you very constructive feedback in terms of where you struggle, where you excel in relation to your peers and so forth. I'll hand it back over to Tina.
Oh, thank you so much, Jay. And yeah, thanks everyone for your patience dealing with the internet capability as well. So I guess, we've got about 5 to 7 minutes left on the call, and we'd love to help answer any questions that anyone might have. Feel free to jump on or pop a question in the chat, and we'll get those covered off for you. But we really hope that you've enjoyed today's session and you've learned a lot about Vantari and certainly the capabilities of virtual reality training.
Yes, thank you. Thank you, Tina. Thank you, Sharon and Jay. That was a fantastic demonstration of the capabilities that you offer. And yeah, so it was lagging a bit, but we certainly got the gist of it. And it was really, really useful to see that platform in action. And thanks for all the explanation about the capability, the platform, and the benefits that it helps the industry. So yeah, just open for everyone to ask any questions. Yeah, go ahead, Andy.
Yeah, hi, my name's Andy Buck. I'm an emergency physician from Melbourne. I work at the Royal Melbourne's trauma centre here, and I'm the director of the ETM course, the Emergency Trauma Management course. So we teach trauma reception and resuscitation. We run courses all around Australia and New Zealand, and hopefully taking the course overseas next year. And I've got put onto Vantari by Christine Bowles, who's a FASM up in Sydney at St. George, who's doing some work with Uni of New South Wales, and told me about your project. Sounds amazing. And so I've been sort of watching from the sidelines. That was an awesome demonstration. Thank you. It strikes me that in this initial iteration, it's very procedure focused, and the fidelity is fantastic. Have you looked at expanding to more sort of multi-person simulation type environments where there's actual sort of dynamic cases evolving, that sort of thing, as opposed to just individual practitioners performing procedures?
You go ahead, Jay.
Yeah, it's certainly on our roadmap. We've already started on that journey with some specific projects that will be launching this December that enable a version of collaborative VR. But yes, definitely, that's definitely on the roadmap, and we're marching towards that because that is a very powerful use case, such as a resuscitation case and so forth, where you can actually recreate an entire simulation and scenario specific to that.
Fantastic, thanks. Look forward to seeing it.
Eddie?
Any other questions from the audience? Yeah, I've got something. So how about motion sickness? So essentially, when you put forward a VR simulation, so more often than not, I've seen people go, "Hey, I really have this headache after the use of this simulator system." Have you ever heard of it? Was there a challenge to reduce the motion sickness? How did you go about doing that? Yeah.
Yeah, it's a really good question. I'll take a stab at it and then hand it to Tina and Sharon. Actually, it's a lot of kudos to our CTO and our technical team and creative director team. Motion sickness there's primary two reasons for motion sickness. One reason is that you're asking your VR headset to do too much, so there's a lot of latency, which is one of the reasons we're on a high performance laptop that's handling a lot of the performance of the simulation. So that's a huge component to that. Standalone VR headsets just aren't there yet in terms of dynamic imaging functionality and especially the complex simulation that you're doing. So as the frame rates drop, what you're doing is you have latency and your brain's trying to fill in that space, causing you motion sickness. The second component is the type of experience that you are building. In a procedural-based experience that we offer, you're literally within a 2 meter by 2 meter space looking to the right and to the left, and you're operating at a very high FPS. But if you were doing this on a roller coaster and so forth, so it just depends in terms of the type of experience that you've built. We can't rule out motion sickness, but we've really solved it where we go to conferences all the time or demonstrations where users don't want to put on a headset because they've experienced something in the past. And we say challenge accepted, and they give it a go, and then we can't get them out of the headset. So it's actually one of the strengths of Vantari VR, where we, unless it's a very, very severe case, I've never experienced it in my 2.5 years of actually myself in a headset. Spending multiple hours in a headset a day, but even at conferences where our system has caused somebody to get sick. Tina, Sharon, I don't know if you have encountered that, and I'll let you chime in.
Yeah, I think you've answered that perfectly, Jay. And no, I haven't experienced it myself either. And someone told me along the way once, and you made mention to it slightly, Jay, is around control versus no control. So certainly in the Vantari platform, you're making informed decisions, deciding to do each step, followed by obviously the comfort of a narrator. But there's no surprises like being on a roller coaster or so having some uncontrolled feeling that would give you that kind of unnervy motion sickness. So control versus no control is certainly a factor.
Yeah, and this is also reflected in what we've observed through some of the studies, the feasibility studies that we've done. So, for example, the University of Wollongong study that's published, and happy to share that. The sort of adverse or side effects were also monitored, and there weren't any cases, or in some of the studies, very, very low cases of motion sickness being observed, especially as compared to other VR experiences. So as we continue to build the evidence base, we'll also see that sort of quantified.
Yeah, brilliant. Thank you very much. Final question. Tethered versus untethered. What's your sentiment on that? And if it's being tethered to a PC and using PCVR, have you faced any obstructions when the trainees go around when they try to move about in the virtual environment? What's your thought on that?
Yeah, so I can answer that. Actually, the link cable is about 16 foot long. Typically, we secure it and it's strapped behind the headset, so it's always behind the user. One other component of tethered and versus untethered, for example, Henry Ford Health, which is one of our VR Center of Excellence here in North America, they've set up a local area network specifically for Vantari. So therefore, all you really need is communication between the laptop and the headset. So if you give it its dedicated network, off it goes. So it's actually never been a problem to date.
Yeah, brilliant. And is it headset agnostic, or do you need to use a Quest 3?
We operate on the Quest 3, Meta Quest 3 or Meta Quest platform. But yes, we're working towards making it hardware agnostic. We have done some projects that are specific to, say, HTC in the past. But it's something like for now, for example, we are working on a Think Reality, which is the VRX headset. So we can say hardware agnostic or specifically VR headset agnostic, but to be able to support it and build all the functionality around it, our clients love the Meta Quest 3, and it runs on the laptop. So the privacy issues don't really apply to us because it's executable on the PC.
Yeah. Well, thank you, Jay. Thank you, Tina and Sharon. And it's been a really pleasurable SIMCAFE this time. really enjoyed looking through that demonstration and understanding what Vantari VR does. I'm sure it's the same for all the everyone in the audience. And this session, which is recorded, will be on our SIMCAFE YouTube channel, and it will be sent out to the members and the registered attendees. Once again, if you want to reach out to Tina, Chiran, and Jay, hit them up on LinkedIn. Yeah, thank you very much for joining, and thank you once again, Tina, Jay, and Chiran.
Yeah.
Thank you.
Very much. Thanks everyone for having
Thanks
us.
all. Thank you.
Thank you.
Very much. Cheers.